already been in Gauteng this afternoon as we commemorate a year of COVID-19 to KwaZulu-Natal now, where you'll remember our first COVID-19 case was actually recorded. Patient 0, 38-year-old man from Hilton in the Midlands in that province who had visited Italy. The Health Minister, Dr. Zweli Mkhize, today visited the province as part of the commemorations. Our reporter Karinda Jagmohan was following the events for us. She joins us live to reflect on the day. Karinda, good afternoon to you. I mean, for the Health Minister, this must have been the busiest, most difficult year of his political life.
Good afternoon to you, Stephen. It's been quite a busy day in KwaZulu-Natal as the Health Minister, along with members of the KwaZulu-Natal government, marked a year of COVID-19 in South Africa. As you said, we saw the first case being diagnosed in KwaZulu-Natal. Patient 0 was a 38-year-old man from Hilton in the KwaZulu-Natal Midlands. He had travelled to Italy with a group of friends and is believed to have been infected in Italy, which at the time was a hotspot for the virus. Once he arrived in South Africa, he started experiencing symptoms, and then his local private doctor, who had known about COVID-19, identified those symptoms, alerted health authorities, and then we saw, of course, that statement coming out from the health department about the fact that COVID-19 we've seen a COVID-19 case in South Africa. Today, Stephen, we saw the Health Minister really speak a lot about his journey over the past year. This was at Gray's Hospital in Pietermaritzburg, where patient 0 and some of the first COVID-19 cases were actually treated. And over there we saw the Health Minister speak about, the first call he had to make to the President. He said a call he wished he never would have had to make, but one that he had to alert the government in the fact that the pandemic has reached South African shores. And then going forward as well, we heard about the frontline doctors, the first group of doctors who treated that first COVID-19 case, and the experiences they had. They said that they were already preparing for COVID-19 because the health sector had been made aware by the World Health Organization about the spreading of this virus. But little did they know that they would actually be the ones to treat the first case, some of them saying that they thought that this was in fact fake news. And they said that the time that they waited for patient 0 to come to their hospital doors, although it was an hour, for them it felt like a day, and loss of anxiety that they experienced. Dr. Halima Dawood, who I spoke to earlier in the day, was the doctor at Gray's Hospital who treated the first COVID-19 case, and she told us that unfortunately in many cases some nurses experienced stigma at the time. She says that in many cases nurses in uniform, in their Gray's Hospital uniform, when they went out to superstores, they were actually people had stigma against them, and this is some of the challenges they faced. Moving forward though, the Health Minister speaking about his arrival to KwaZulu-Natal at the time, how he had to contact the Health MEC and Education MEC to move to the Cowan House School in Hilton, the suburb where the first case was diagnosed, to actually allay, calm the fears of the community who didn't know about the virus. And even at the time we were there, Stephen, with the Health Minister explaining to South Africans about this relatively unknown virus and trying to allay the stigma against that. And then he says he received hope though when he went after that to the Gray's Hospital in Pietermaritzburg, where nurses were already prepared. They knew how to don their PPE, but also they came forward to him singing songs of hope, songs of resilience, saying they were not afraid to treat COVID-19 cases. And since then, he says it has been a rough journey for South Africa, the health department as well as the national government having to contend with many sectors as they try to curb the spread of the virus, but as well as ensuring that South Africans are safe, healthy, and economically secure during this time. So it's been a tough time for the health department, but towards the end of the day I managed to speak to the Health Minister to ask him when will we see ordinary South Africans being able to take the COVID-19 vaccine, and he says that by April they will begin the rollout on the next stage, or rather the next stage of the rollout of the vaccine, and this will see people with comorbidities as well as community service workers being inoculated with the vaccine. This includes taxi drivers, mine workers, policemen, firefighters, those people who are in their jobs on the front line of community service, as well as those who have comorbidities. He says that the health department aims to vaccinate at least 60 million people in that specific stage, which may take around 6 months. But currently, the rollout of vaccines for health workers are underway. In KwaZulu-Natal, there are several vaccination sites. I'm outside one of them. This is the Nkosi Albert Lutuli Central Hospital in Durban. We were earlier at the Edendale Hospital, where there's another vaccine site. Then we saw health workers already in line to get their vaccines, or rather to get their vaccines, and the minister just adding and emphasizing that it is important for South Africans to take this vaccine, as it ensures that we are not exacerbating the spread of this virus.
Karinda Jagmohan, thanks very much indeed. Really do appreciate it, live from KwaZulu-Natal this afternoon.